I'm Bruna Pellini. I'm an assistant member in the Department of Thoracic Oncology at Moffitt Cancer Center. I'm here at ASCO presenting my poster on ctDNA monitoring for patients with advanced non-small cell lung cancer. So the idea for this work was that some patients that receive chemo with immunotherapy and go into maintenance, there's a lot of variability in the timing and the duration of maintenance therapy. So we posed the question, can we stratify these patients in terms of risk and see who will really benefit from this maintenance therapy and who is at high risk for relapse? So we used a tumor-informed assay to identify some variants of interest to monitor them over time using the Foundation One Tracker assay. So here you can see it describes the assay. And then we tested the ctDNA sample at different time points. And we also monitored the differences in ctDNA levels from baseline to cycle 2, cycle 3, and cycle 4. What we found is that even if you don't have a baseline sample and you assess the ctDNA levels at cycle 4, day 1, they are predictive of outcomes, both progression-free survival and overall survival. Also, what we found that was very interesting in the exploratory analysis is that patients that have ctDNA positive at cycle 4, day 1, giving them 2 extra cycles of chemo IO does not improve outcomes. So bottom line, these patients are not responding to this therapy already. They are high-risk patients for relapse. We really need to think of different ways of treating them. And we also found that different cutoffs of decrease to increase 50% or clearance, they're all predictive of both PFS and OS. And this prognostic value of this biomarker was maintained, controlling for different clinical and pathological variants. So I think the future is we have this assay, we know it's prognostic now. How can we implement that into clinical trials to really guide our clinical decision making? And that's where I see the future of this assay in our clinical practice.